A really common question that I get as a sex therapist is whether or not subdrop and postcoital dysphoria are the same thing. Hi, I'm Dr. Kate Balestrieri. I'm a licensed psychologist, certified sex therapist, and the founder of Modern Intimacy. Today I'm going to discuss two important concepts in sexual health, subdrop and postcoital dysphoria. While these terms might be unfamiliar to some, they are significant experiences that can affect emotional and mental well-being after sexual activity. So today we'll explore whether subdrop and postcoital dysphoria are the same thing, how they're alike, how they're different, and how you can address both. Let's start with some definitions. Subdrop is a term commonly used in the BDSM community. It refers to the emotional and physical drop that a submissive partner might experience after an intense BDSM scene. This drop can include feelings of sadness, exhaustion, anxiety, even depression, and it frequently occurs due to the sudden decrease in endorphins and adrenaline that were elevated during the BDSM scene. Now, a common question I get is, can tops also experience top drop? The answer is yes, but often subdrop is more intense. Postcoital dysphoria, on the other hand, is a phenomenon where individuals feel sadness, anxiety, irritability, or agitation after consensual sexual intercourse. This can happen regardless of the nature of the sexual activity, and it can affect anyone, regardless of gender or sexual orientation. The exact cause of PCD is not really fully understood, but it's believed to be related to hormonal changes, emotional triggers, and/or psychological factors. While subdrop and postcoital dysphoria are not the same thing, they do share many similarities. Both experiences involve a sudden shift in emotional state following intense physical activity and emotional engagement. Both can also leave people feeling confused or concerned about their reactions. However, there are some key differences between the two. Subdrop is specifically related to BDSM activities and the dynamics of power exchange within the context of that scene. It's often anticipated and understood within the BDSM community, with practices in place to address it, such as aftercare. Aftercare is the process of providing emotional and physical support to both partners after a scene to help them transition back into a more neutral, affective, or emotional state. So this can include things like cuddling, talking, or engaging in other comforting activities, like maybe enjoying some dinner and a nice movie. Postcoital dysphoria, on the other hand, can happen to anyone after any kind of sexual activity. It's not limited to those who engage in BDSM, and it may not be anticipated by the individuals who are experiencing it. Because of this, people might feel more isolated or confused when they experience postcoital dysphoria. So how do we address subdrop or postcoital dysphoria? For subdrop, preparation and communication are key. Engaging in thorough discussions with your partner before any scene to establish boundaries and expectations will help. Aftercare is critical. Make sure to plan for it and discuss what each partner needs to feel safe and supported when you transition back to that neutral state. So this can include things like physical comfort, verbal reassurance, hydration, rest. Understanding and normalizing the experience within the BDSM context can also help reduce feelings of anxiety or confusion. For postcoital dysphoria, it's important to acknowledge and validate your feelings. Understanding that postcoital dysphoria is a relatively common experience can help reduce any feelings of shame or isolation. Communicate with your partner about how you're feeling. This can foster a sense of connection and support, even if your feelings are difficult to understand. Taking time for self-care, like engaging in relaxing activities or practicing some mindfulness, journaling, or even speaking with a therapist can also be really helpful. If either subdrop or postcoital dysphoria are significantly impacting your well-being, seeking professional help is a really good step. A sex therapist can help you explore the underlying causes and develop strategies to help manage these experiences. So thanks for watching. If you found this video helpful, please like, share, and subscribe for more insights on sexual health and relationships. Remember, understanding and addressing these experiences is an important part of maintaining emotional, sexual, and mental well-being. So take care. See you next time.